So when there is some attack or insult to the white matter, it results in demyelination, that is loss of myelin sheath, and this results in varied neurological problems. They come with fever, which may be brief, not very persistent, and that is how we differentiate it from any other infections. Also encephalopathy, that is they are unable to recognize their parents, they are unable to interact with their family members in their usual way that they used to be. So a very good morning to all. I'm Dr. Arundhati Banerjee. I'm consultant pediatric neurologist associated with Neotia Bhagirathi Hospitals, Newtown. So today I thought it would be pertinent to discuss a very not so rare topic of childhood neurological problems in the form of acute demyelinating disorders of childhood. So what is that? Actually, in our brain, we have two salient parts. One is the white matter, which is the myelin sheath, and is the gray matter. So when there is some attack or insult to the white matter, it results in demyelination, that is loss of myelin sheath, and this results in varied neurological problems. So how do these kids present? They come with fever, which may be brief, not very persistent, and that is how we differentiate it from any other infections like meningitis, encephalitis, or other CNS infections. But following the fever, there may be a lag period of 2 to 3 weeks when they remain more or less normal or a little bit irritable, and then they develop these features. The clinical features can be in the form of seizures or abnormal movements in which the child presents with altered sensorium, irritability, uprolling of eyeballs, stiffening of the body, episodic, and also encephalopathy. That is, they are unable to recognize their parents, they are unable to interact with their family members in their usual way that they used to be. So why this is important? Why is it important for the awareness of this disorder? Because it is not so rare a disorder. So we get it at 1 per 1 lakh in the population, and we get it while as a neurologist we get it quite often. Why is it important? Because apart from the symptomatic management, that is apart from treating these children with anticonvulsants or with antibiotics or with antivirals, what is required is that we have to give something called immunotherapy. So as I mentioned earlier, what is the cause of this insult? It may be a viral infection or a bacterial infection that triggers the insult and the loss of myelin sheath, and this is an autoimmune phenomenon. So in order to counteract this autoimmunity, what we give is immunotherapy. Immunotherapy comprises that is very high dose steroids, injections, and IVIG, IV immunoglobulin, which are synthetically prepared human sourced immunoglobulin, which helps to boost up our immunity. And unless we treat these children with these immunotherapy, they do not respond in a favorable manner. And the bottom line of it is that they should be treated, because if they are treated properly and if they are treated early, then they can absolutely resort to their pre-morbid levels. They can become as normal as they were. So with that, I would like to end my session, and thank you for your patient hearing.